Hello, you are welcome to this channel. Today's presentation is on Introduction to Anemia. Introduction to Anemia. Anemia is the decrease in hemoglobin concentration and/or red blood cell count below the normal range. The normal range of hemoglobin concentration is determined by several factors. These include 1. Age, 2. Sex, 3. Race, 4. Altitude, which is the distance between the ground level and the sea level, and 5. Pregnancy status. Normal ranges of hemoglobin and prevalence of anemia. Worldwide, the normal ranges of hemoglobin concentration in adult males is 13.5 to 17.5 grams per deciliter. For adult females, it is 11.5 to 16.5 grams per deciliter. And in children, the normal range is from 11 to 16 grams per deciliter. So if your hemoglobin concentration falls below these ranges, it means you have anemia. These figures are also not cast in stone. It may vary slightly from one population to another. The prevalence of anemia worldwide for the general population is 24%. So meaning if you strike the prevalence of anemia for all persons, including children, women, men, the value will be 24%. And the prevalence of anemia worldwide for women aged 15 to 49 years is 30.7%. The prevalence of anemia for Ghanaian women aged 15 to 49 years is also 41%. The 15 to 49 year age group of women is very significant because in that age group, the women are very susceptible to getting anemia. This is due to 1. Blood loss through menstruation, and 2. Excessive demand of iron, which is required for the formation of fetus during pregnancy. And this makes women susceptible to anemia. So blood loss through menstruation and increased demand for iron, which results in anemia. Causes of anemia. The causes of anemia are also referred to as mechanisms of anemia. There are 3 major causes or mechanisms of anemia. And these include 1. Loss of blood. This simply means blood loss through bleeding from any part of the body, whether from the gastrointestinal tract or from the gum, or blood loss through menstruation. The second major mechanism of anemia is deficient erythropoiesis. Deficient erythropoiesis. Erythropoiesis is the process by which red blood cells are formed in the bone marrow. So any factor or the micronutrients which are required for the formation of red blood cells, when absent, can result in impairment in the production of red blood cells. Also, infection or cancer affecting the bone marrow can also result in a decrease in the production of red blood cells. The third major mechanism or cause of anemia is excessive hemolysis. Excessive hemolysis. Hemolysis is the breakdown of red blood cells. So any genetic defect that makes red blood cells susceptible to breaking down or hemolyzing can result in anemia. For example, sickle cell anemia or G6PD deficiency anemia. Also, any infections and some medications can also result in increased destruction of red blood cells Immunological factors, immune system hyperactivity can also result in increased destruction of red blood cells. Clinical features of anemia. So the clinical features of anemia, you mean the signs and symptoms of anemia. So the clinical features of anemia can be grouped into two major categories. We have number one, the general signs and symptoms, and two, the specific signs and symptoms. So general signs and symptoms. The general signs and symptoms are present in all types of anemia, irrespective of the type of anemia that a patient may have. They may present with any of these signs and symptoms. So we have fatigue, shortness of breath, pallor, that's to become pale, weakness, lethargy. Lethargy means you lack energy or motivation to carry out your activities. You become very, very sluggish. Then we also have palpitation, that's increased heart rate. Your heart beats faster and also irregularly. And we have also headache. So these are the general signs and symptoms of anemia. These symptoms generally result from decreased oxygen supply to the various parts of the body. Then we have specific signs and symptoms of anemia and their clinical features. Specific signs and symptoms. So these specific signs and symptoms are unique to the various types of anemia. So for example, if somebody presents with iron deficiency anemia, a classical specific signs and symptom or specific sign that will show is called koilonychia. Koilonychia means the fingernails become concave and brittle as seen in the diagram. So the fingernails, this is the thumb, the nail has become concave and also brittle. It's called koilonychia. This one is unique to iron deficiency anemia. Then we also have another example which is called jaundice. For those of you who studied French in your junior high school or primary school, the French word for yellow is jaune, yellow. And it has its root word in Latin. Jaune means yellow. So jaundice means yellowish. So jaundice is a classical sign of hemolytic anemia. In hemolytic anemia, there's excessive breakdown of red blood cells, which leads to increased amount of bilirubin that deposits in the eyes and then in the skin. So for example, in this diagram, the sclera of the eye has become yellowish. The skin has also become yellowish. So the yellowish appearance is what we call jaundice, and it's specific to hemolytic anemia. Classification of anemia. There are several ways by which anemia can be classified, but one of the most important classification schemes makes use of red blood cell indices. The red blood cells indices are just parameters or measurements about the sizes of the red blood cells and its hemoglobin content. So based on red blood cell indices, anemia can be classified into three major categories. So we have 1, normocytic pneumochromic anemia, 2, microcytic hypochromic anemia, and 3, macrocytic anemia. So let's take them one after the other. Let's have a look at this table. So the first column is normocytic pneumochromic anemia. Normocytic means the red blood cells have normal size. So in normocytic pneumochromic anemia, the MCV is normal. That's between 80 to 95 femtoliters. And the normochromic means the red cells have normal hemoglobin content. So the hemoglobin content is less than or equal to 27 picogram. It's greater than or equal to 27 picograms. So the hemoglobin content is not below 27 picograms. So in normocytic normochromic anemia, MCV is normal and MCH, which is the mean cell hemoglobin, is also normal. The MCV is the average size of the red blood cells. MCH is the average amount of hemoglobin in gram in the red blood cells. These types of anemia fall under normocytic normochromic anemia. So we have 1, most cases of hemolytic anemia. 2, some cases of anemia of chronic disease. 3, in acute blood loss, patients may present with normocytic normochromic anemia. Bone marrow failure and renal disease can all result in normocytic normochromic anemia. Then in the second column, that's under classification of anemias, you have microcytic hypochromic anemia. In microcytic means the red cells are smaller than normal, and hypochromic means the hemoglobin content is below normal. So in microcytic hypochromic anemia, the MCV is less than 80 femtoliters. The MCH is also less than 27 picogram. Examples of anemias that fall under microcytic hypochromic anemia are iron deficiency anemia, thalassemia, and then some anemias of chronic disease and sideroblastic anemia. Then lastly, we have macrocytic anemia. Macrocytic anemia. Macrocyte is a bigger red cell, a red cell which is larger than normal. So in macrocytic anemia, the MCV is greater than 95 femtoliters. And we have 2 major types of anemias under macrocytic anemia. We have the megaloblastic anemia. The megaloblastic anemia simply means we have megaloblasts in the bone marrow, and they arise from vitamin B12 deficiency or folate deficiency, and also the use of some medications, some anti-cancer medications, can all result in megaloblastic anemia. Then we have 2 non-megaloblastic causes of macrocytic anemia. Under that one, we have alcoholism, liver disease, aplastic anemia, myelodysplasia, and so forth. Investigation of anemia. Investigation of anemia. In investigating anemia, there are 3 steps that we go through. Number 1, we have history of the patient. The clinicians take the history of the patient. They ask pertinent questions that may reveal the type of anemia that the patient has. Questions that will determine whether they have genetic disease, questions that determine their dietary history, or even the symptoms or signs that they experience. Then from history taking, we come to number 2, physical examination. They may examine the body of the patient to see if there are any physical signs that will pinpoint to the type of anemia that they may be presenting with. So they may examine the conjunctiva, the sclera of the eye, even the heartbeat may also be taken, and so forth. Then number 3, we have laboratory investigation. Laboratory investigation. This is where blood sample is taken to the lab to be investigated to determine or to get an empirical evidence as to the cause of anemia. The laboratory investigations are grouped into 2. We have routine laboratory investigations. These include complete blood count, reticulocyte count, and blood film comment. So these are routine laboratory investigations. And based on the results of the routine laboratory investigations, we may request further tests. Further tests may be requested to narrow down on the type of anemia that the patient has. So for example, if routine investigation shows that the patient is likely to have sickle cell anemia, we may do sickling and HB electrophoresis. If the routine investigation points to iron deficiency anemia, iron profile may be carried out, and in some cases, bone marrow sample may be taken and the iron stores will be assessed using special stains. Treatment. The anemia itself is not a disease. Anemia is not a disease on its own. It is rather a manifestation of an underlying medical condition. So in treating anemia, the underlying medical conditions needs to be determined and treated. And together with supplementation with vitamins and minerals, the anemia will resolve. These are the references for this presentation. Thank you very much for watching this video. Please subscribe to the channel and leave your comments in the comment section. Thank you very much. Bye bye.